Hello, Jeannie. It's Dr. Mulroy calling. I'm glad that you were able to take the call today. How are you doing?
Oh, I'm doing okay.
The last time we talked, you mentioned you had some struggles getting around the house and some headache still bothering you. Has there been any change?
No, I still have the same symptoms we talked about last week, and a little more clumsiness. Nothing
Okay,
new.
right. Jeannie, I'm calling and would like to talk to you about something that's developed related to the pandemic. And around the country, hospitals are limiting the number of people coming and going to the hospital for various treatments, including cancer treatments, because we're worried about that being a way of spreading the virus. And that COVID, it can be very serious for people who have other health troubles, including cancer.
Oh, yes, yeah, I understand that.
Yeah, when we talked last time, we kind of went through and I described a plan to you where we'd be using radiation treatment for
Right,
about 3 weeks, along with the chemotherapy pill.
right.
But because of the COVID-19 pandemic, we've had to make a change in kind of our policy in the hospital, and we need to
A
use other
change. Wait a
treatment.
minute. A change. What do you mean? What do you mean a change? You said radiation was the best way to go.
You're right, and I do think radiation is a good and an important treatment, but the difficulty is that the radiation could actually, and coming to a hospital for a series of treatments could actually endanger you or cause you to be at greater risk for getting the virus. So it's complicated, but
Oh
right
yeah, but
now we
I'm so sorry. I have to interrupt you. I understand that it's complicated, but you said that radiation was the best way to go, and now that's changing. I'm really confused. Uh, um, what is this? Are you doing this because I'm old? What does this mean?
yeah. No, you're right. Again, Jeannie, that radiation can help people live longer, and we use it with the chemotherapy pill for that reason. But radiation means coming in 5 days a week for 3 weeks, and every one of those trips exposes you to a lot of different people and a risk of picking
Oh,
up the virus. And that,
I hear what you're saying, and I know that with cancer, I'm at high risk. I know all that, but it just sounds to me like you just think I'm old and I'm not worthy, or maybe, maybe it's because I'm black. What is this? This is all too much for me.
I understand your reaction, and I really feel badly about this. But we are delaying radiation for all patients who have this kind of cancer and this stage of cancer and are a treatment goal like yours, and
But
which to help.
I know people with cancer who are still getting radiation.
Hmm. No, you're right, and we've had to make what are very hard kind of decisions that apply to everybody, and it I can assure you it's not your background or color or we've had to make these decisions, and it's a real struggle.
Well, if it's not that, does that mean that I'm going to die sooner? Is that what that means?
I
I'll
honestly
die sooner?
I honestly can't say for sure. Obviously, I the other treatment we have is to go ahead with the chemotherapy pill, and then as soon as if
Oh
radiation
my
becomes
goodness.
safer to do at some point, we can reassess things.
Well, you're talking
Um,
about the chemotherapy pill. Does that mean I'm going to have to come in for appointments and expose myself to
yeah,
COVID-19? I can't risk that either. I don't want to die without being able to see my family. It's important to me to be able to see my family. I haven't been able to see them because of the COVID-19.
yeah, you're right. Now the one thing about the pill is it really just involves the one visit to get started on it, to get out the prescriptions and all the support, and then everything after that can be set up by phone. And you do, and even to do some periodic blood tests that can be arranged to minimize any risk. So you don't have to come in and be supervised the way you would going through daily radiation treatments.
Well, do I have to come in? What happens? How do I get blood tests?
Yeah, well, that's something we're going to have to look into and clarify the details on that, and how we can set that up. But again, a blood test periodically is still, in my mind, safer than having to come, daily for that long stretch of time.
All this change, this is making me really confused. I watched a family friend of mine dying of cancer. He wasn't able to do anything for himself. He was dependent on everybody to do things for him. I don't want that to happen to me. You can't let that happen to me.
I hear you, Jeannie, and again, I understand your frustration, and I can assure you are trying to do the best thing we can for you in this situation is what we're trying to do. And it's frustrating, but I'm still going to be your doctor, still work with you and with the nurses and other doctors around the chemotherapy pill treatment. But I understand your fears, and we want to try to keep you well, but really am concerned that we could endanger you and risk you sadly from dying more quickly if you get this virus through a transmission by coming to hospital.
Well, the other thing I'm really concerned about, I want to be able to see my daughter and my grandkids and before I die. And the way things are now, we can't see each other, and I can't die without seeing my family. Well, I just feel horrible.
I understand, and I know that must be very hard for you and for all of your family. I think in a situation like this, if we identify, your family as the small group you can interact, be with, and are as careful as possible, that is possible. And I think it would be good not only for you but your family.
Oh, it certainly would.
Abandon you, and we're going to keep looking after you as well as we can.
Well, I'm glad to hear that, and that makes some difference, because I just thought the healthcare system was set up to help people and make them feel better, and I don't want to die alone without seeing my family. And I try to understand what you're saying, and I know this COVID-19 is affecting all of us, but I just hope you can continue to help me the way I need help, and to help me prolong my life as long as I can, and to be able to see my family. That's what's most important to me.
I hear you, and I will do that. We will, with the team, monitor how things are going, and the next time, probably be in about a month, I'll contact you by phone and review all how things are going to that point, and talk to you about your symptoms, and give you an update about how we're looking after people with cancer and whether we are able to expand the treatments. So I will follow up with you, and you can call us anytime through the contact information we've given you already.
I could call you anytime, but you're saying I won't hear from you for a month, you said?
That's right. But in the meantime, you'll get all the details from another doctor and a nurse about starting on the chemotherapy pill. So
okay.
Won't delay that part. That's going to go ahead as soon as we can.
Okay.
But the radiation is on hold, and right now I just think the danger, it puts you at a risk for danger, that for safety reasons, it's better to go with the pill on its own right now. It's hard. I hear what you're saying exactly, and I'm struggling with this too.
Well, I thank you for that, and it's an awful lot for me to take in, and I know with this COVID epidemic, we have restrictions on everything and everybody, but if I feel like you're going to help me, so that makes me feel better. help me see my family, help me get through this in a meaningful, in a way, you know, the best we can.
That's right, and we will do our very best. So please keep well, and we'll be talking soon.
Okay.
Take care now.
You too. Thank you.